You eat less salt, you try to walk more, and you've cut out the obvious junk food. Yet, every time you wrap that cuff around your arm, the numbers are still stubbornly high. Why? Because the modern world is a minefield of vascular disruptors. We've been taught that hypertension is just about salt and genetics, but that's only half the story. Today, we are uncovering 10 hidden causes of high blood pressure habits and environmental factors that are clinically proven to spike your BP, yet are rarely discussed in a standard doctor's visit. By the end of this deep dive, you'll realize that your healthy routine might be the very thing keeping your pressure in the red zone. Millions of people take NSAID dislike ibuprofen or naproxen for minor aches and pains without a second thought. But from a nephrology perspective, these are vascular hand grenades. NSAIDs inhibit prostaglandins, chemicals that keep your blood vessels open. When these are suppressed, your blood vessels constrict, and your kidneys retain more salt and water. A study published in the Journal of Clinical Hypertension found that regular use can raise systolic BP by up to 5 points. If you're managing chronic pain while fighting hypertension, you're essentially fighting a war on two fronts. If you snore or wake up feeling exhausted, your blood pressure isn't high because of what you do during the day. It's high because of what happens at night. Sleep apnea causes your airway to collapse, stopping your breathing for seconds at a time. Every time this happens, your brain triggers a fight or flight response, flooding your system with adrenaline to wake you up. This causes a massive surge in blood pressure that persists long after you wake up. This is secondary hypertension, and until you treat the oxygen drop, no amount of medication will fully stabilize your heart. For decades, salt was the villain, but modern cardiology is pointing the finger at high fructose corn syrup. Excessive sugar intake, particularly fructose, increases levels of uric acid in your blood. High uric acid inhibits nitric oxide, the gas your body produces to help your arteries relax. When nitric oxide levels drop, your arteries become stiff and narrow. It's not just the salt in the fries. It's the sugar in the ketchup that's hardening your vascular system. This might sound like psychology, but it is pure biology. Clinical studies from the University of Chicago have shown a direct correlation between chronic loneliness and a significant increase in systolic blood pressure over a 4-year period. Loneliness creates a state of hypervigilance, a constant, low-level stress response that keeps your cortisol levels elevated. Your body perceives isolation as a threat, keeping your vascular tone high. In the West, social isolation is becoming as big a cardiovascular risk as smoking. How you breathe matters. Your nose is a chemical factory. When you breathe through your nostrils, you produce nitric oxide in your sinuses. As we mentioned earlier, nitrogen monoxide is a powerful vasodilator. If you are a chronic mouth breather, especially while sleeping, you bypass this natural medication. You are essentially starving your blood vessels of the very gas they need to stay flexible. Simply retraining yourself to breathe through your nose can lead to a measurable drop in resting blood pressure. Colds are annoying, but the sinus relief pills you buy over the counter could be dangerous for your heart. Many contain pseudoephedrine or phenylephrine. These drugs work by shrinking blood vessels in your nose, but they don't stop there. They constrict blood vessels throughout your entire body. For someone with borderline hypertension, a single dose of a decongestant can push them into a hypertensive crisis. Always look for HBP versions of cold medicine that are free of stimulants. Think of magnesium as nature's calcium channel blocker. While calcium causes muscles, including your heart and arteries, to contract, magnesium allows them to relax. Due to soil depletion and processed diets, over 50% of people in Western countries are magnesium deficient. Without enough magnesium, your arteries stay in a state of microcontraction. This chronic tightness raises your baseline pressure. Supplementing with magnesium glycinate is often one of the most effective natural interventions for vascular health. Exposure to screens late at night suppresses melatonin and raises nighttime blood pressure. #9. Caffeine timing. Drinking coffee within 6 hours of bedtime disrupts your dipping, the natural drop in BP that should happen while you sleep. #10. The alcohol myth. While a glass of red wine is often called heart healthy, even moderate daily alcohol consumption increases arterial stiffness and elevates heart rate, contributing to long-term hypertension. High blood pressure is rarely caused by one thing. It is the sum of these hidden habits. The good news: Most of these are within your control. Switch your painkiller, check your snoring, and breathe through your nose. If you found this clinical breakdown helpful, share it with someone who is struggling with their numbers. Take care of your heart, and it will take care of you. Subscribe for more deep dives into the science of longevity.